Hello, my name is Donna Edgel, and I am one of the nurses here at Olean General. I'm here to teach you a little bit about what to expect whenever you're expecting, such as the book says, and what to expect about yourself, what's going on with childbirth, what's going on with your body, and what to expect with baby comes and alike. I just want to let you know that first off, each baby is different and every woman is different as to how they experience this wonderful thing of bringing a child into the world. So just keep that in mind. Forget all the horror stories that you've heard from your grandmother and your mother and your aunt and your cousin and your neighbor next door. This is your experience, and this is just a little bit about what you can expect through this experience of what your body is doing and alike. So whenever we have something happen to us, we get like a little adrenaline rush. You know, you're excited, things are happening. All right, I'm going to be a mom, all that fun stuff, or I'm going to be a dad. All right, it tends to make our muscles tense because we're a little tense. We're not sure what's going on. You're hurting. Okay. Contractions are painful. No matter what anybody tells you, contractions are painful. It's gonna hurt. Okay. Even with the medications that we have to kind of help that, which we'll get to later, it's still gonna hurt. So you need to be prepared that, yeah, it's gonna hurt, but you can get through it. Okay. That's what we're here for. Sometimes whenever it is painful, it causes fear, which causes more adrenaline, which causes tension, which causes painful contractions, etc., etc. So within this childbirth class, we want to break those chains, okay? So what are some of the goals that we have for this, okay? What are your goals? Your goals are going to be different than everybody else's. What can you expect to learn in this childbirth class? One of the things that we want to go over and make sure that you understand that pregnancy is a state of wellness, not illness. You're not sick normally whenever you're getting ready to have a baby. Labor and delivery is a normal, healthy process in going through life and having your baby. We need to trust the process of labor and work with your body, okay? It's to teach you what's going on so that you know how to work with it, what the next step and what's coming up, so that you can deal with that one step at a time. Tools to cope with labor and delivery in that process, we'll give you some of those as we're going through today. Options available for your pain management and managing your labor all around. And accurate, factual information about labor, delivery, the postpartum period, and what to expect with your newborn appearance, which is in a different slide. This is basic anatomy. This is basically what you look like non-pregnant and pregnant. It's kind of like if somebody were to take a saw and cut you right in half. This is kind of what your insides look like. This here is your uterus. This is your bladder, some of your bowels here off and on. Your stomach is way up here. Yes, it is way up there. And then this is your liver, diaphragm, lungs, okay? With pregnancy, as this baby gets bigger and bigger and bigger, you can see where it pushes on your bladder. That's why you got to pee so much. It kind of pushes on your rectum, so that's why you can get constipated. Pushes up on your stomach. See the different size in your stomach there? That's where the indigestion comes from. Liver gets pushed up there, and your lungs don't have as much room as they would have because everything's pushed up, okay? So some of the things that can happen because of all these different things is what we're going to go over next. In your book, it goes over a lot of these things too, not necessarily in the order that I'm presenting them. Okay. Loose, achy joints can happen, all right? We have a pelvis here, all right? This is the front view, as I call it, anterior, and this is the lateral or side view, okay? As things happen, okay, this little coccyx here is your tailbone, okay? As baby comes down through, this is what a normal one looks like, and this is what it looks like at the end of pregnancy. So you can tell it's a little wider because it stretches, okay, to let baby come through, and this is just what your normal pelvis looks like, okay? So as those hormones go and make preparations for baby to come through the pelvis, you want to pay attention to your posture, okay? This is one of the times where you don't want to slouch, okay? But you also don't want to do one of these numbers either and just have your back ache that way because of the baby there, okay? You just want to maintain a good posture, almost like if you were a marionette puppet and you have a string tied to the top of your head, and the string master is pulling that up so that your back is straight. It's not easy, but it'll help you out later with that. You want to walk with your back straight. You want to avoid leaning back. Oops. You want to avoid leaning back. You want to bend at the knees whenever you go to lift something up. You don't want to lift with your back. And you want to continue with exercises to keep your muscles good tone. Sometimes in pregnancy you get leg cramps. Okay? Something to help you with your leg cramps. Avoid pointing your toes. Okay? You want to pull them back towards your face more so than pushing them that way. Okay? You want to stretch those muscles, make sure they can stretch, do some of those. Now, I'm not talking about going out and jogging 2 miles. Okay, that's not going to happen. You know that, I know that, it's not going to happen. But continue to stretch the muscles. Make sure that they're up there and stretched. That will help with the leg cramps. Increase your food with calcium and potassium, such as milk, milk products, eggs, yogurt, that sort of thing. I guess eggs are not milk products, are they? No, they're not. Bananas, oh, I did it again. Bananas and orange juice. They all have a lot of calcium, especially the calcium fortified orange juice is really good for those sort of things and helping you with your leg cramps. Okay. Sometimes you're going to get short of breath. That's again from all your organs pushing up on your lungs and getting them compromised there. Avoid sleeping on your back. Lie on your side. Okay, these are some of the things that are going to help with that. Use pillows. You got them, use them. Okay? Prop the head of your bed up. Wear loose, comfortable clothing. When engagement occurs, it may be more comfortable. Now, engagement is another way of saying baby is dropped. Okay? So as baby gets older and pregnancy moves on towards term, baby will drop into the pelvis. Okay? That's what they call by engagement. And if it is severe or reoccurrent, that you can't get your breath, you've got asthma maybe, or something along that line, notify your healthcare provider, obviously, if you can't breathe, okay? Heartburn, yeah, look at those little hot peppers there, okay? It's a common thing, okay? Possible solutions, eat smaller meals more frequently. Eat slow, chew your food. Yes, we like to inhale and gone. Okay, slow down a little bit. That's going to help that heartburn. Don't eat right before laying down. Don't drink large amounts of fluid with your meals. Avoid spicy, hot, fried, or greasy foods. Okay, make sure your head of your bed is up, and talk to your provider before taking any OTCs over the counter. Talk to your healthcare practitioner before taking any over-the-counter medications. There are some exercises that you can do to help with the lactation stuff. Those include basically moving your arms up above your head and then moving them down again. Almost like a yoga type thing. And if you do this, if you haven't done already, you're going to start burping. Okay, so excuse me if I do that because it's already happening there. You're going to pee a lot. Yep, and sometimes it'll feel like you've only done 2 tablespoons, but it felt like it was really full. Again, that's from the baby sitting on your bladder there. There's some Kegel exercises you can do. Take the frequent trips to the bathroom, know where they all are in whatever store you're at. That's helpful. If you have pain or burning whenever you urinate, please notify your provider because you could have a urinary tract infection. They're frequent and they are common with pregnancy, but not everybody has one. Okay? Sometimes you get swelling. So these are your feet before pregnancy, and this can happen with pregnancy. The reason for that is your body, with pregnancy, takes on a whole lot more fluid to provide for the baby, and it increases your blood volume as well, okay? Because with childbirth comes some bleeding. So kind of like with your period, how you bleed and the like, some of that's going to happen afterwards as well. It's not uncommon to get some extra fluid. However, if there's a whole lot of it and you have headaches and some other things, you need to let your provider know. And we'll go over that with some preterm labor things. Some solutions. Don't eat a lot of salt. Elevate your legs whenever possible. If you stand, try to sit as much as possible, and if you sit, stand up, okay? The swelling is going to go to the place of gravity, okay? So that's why we say to elevate your legs, because then that way the extra solution is going to be more evenly distributed and it's not going to go just to your feet. Don't cross your legs when sitting. Try to get up and move around frequently throughout the day. Lie on your side when sleeping or resting. Drink plenty of water, 6 to 8 glasses a day. And we're not talking little glasses, we're talking the gigundo ones. Yes, I know, the more you drink, the more you have to pee. But that's going to help you with keeping your swelling down, okay? If you have too much swelling in your hands, face, or feet, notify your healthcare practitioner. Could be a sign of something more serious happening with a pregnancy. Backache. Ugh. Different things with that. Backache, pay attention to your posture, like we talked about earlier. Walk with your back straight, avoid leaning back, bending at the knees. We've gone over these things before. Round ligament pain. In your book, there's a better picture of what the round ligaments are and the like. Some of the solutions to take care of your round ligament pain is paying attention to your posture, walking with your back straight, avoid leaning back, bending at the knees when lifting. As we've already talked about with backache, some of that can also work with the round ligament pain. Avoid movements or actions that may cause strain on the ligaments. If pain occurs, rest. Okay? If you have abdominal pain and it continues or becomes more intense, call your healthcare provider. It might be contractions, might not be round ligament pain. Okay. I said about hemorrhoids, constipation, again with that baby pushing on your rectum and the like. Be sure that you're eating high fiber diet. Brands, fresh fruits, vegetables, dried fruits, raisins, prunes, apricots, they all help, or apricots depending upon where you're from. They all kind of help out with getting things moving around there so you're not quite so constipated. Drink 8 to 10 glasses of water a day. Try some natural remedies such as apple juice, prune juice, hot drinks, cold drinks, walking or similar exercises if it's okay with your healthcare practitioner. Talk to your healthcare practitioner before taking any over-the-counter medications. Typically, they give you a list of things that are okay or not okay with pregnancy. If you have any questions, please give them a call and notify them. Fatigue and insomnia are another commonality of pregnancy. Your body is going through a lot of changes. Okay? Relaxation techniques are wonderful. Warm showers, massage, imagery, using pillows. I know we all like our caffeine, but if you want some sleep, avoid the caffeine for a little while. Try some warm beverage. Even just plain hot water does wonderful to just get you relaxed and the like. Again, talk to your healthcare practitioner before taking any over-the-counter medications. So you want to come to the hospital, all right? You're getting ready, you think you're in labor. What do I bring? Well, here's a list. It's not inclusive, but some of the things that you might want to think about packing and bringing. Since COVID has come in, our visitation program, our visitation policy changes frequently. So you'll need to check with the hospital prior to coming as to what the most recent policy is with visitations. Change of clothes is what you'll want to bring to when you come home. Clothes to labor in if you want. You don't have to wear our hospital gowns. If you want to wear one of your gowns and get it all bloody and dirty and all that sort of stuff, be my guest. Not a problem. I don't have to do the laundry. You do. Okay. Bring some hard candy, some gum, snacks, music, and a listening device. Ours have walked off over the years, so if you want to listen to a certain station or some relaxation music, oftentimes your phone will be able to take care of that for you. With the phones, you want to be sure that you're bringing a long enough cord and the charging equipment that you would need. I do not advise you to bring your PlayStation 4 and any of those sort of things, because you're really not going to have time to do that. Partners, if you're going to be there with that, your focus should be on her, and the PlayStation 4, the hospital is not a place for that. Okay. You can bring your baby book, going home baby clothes if you have that. You want to bring your camera. Typically nowadays it's your phone that works really good with that, and toiletries. Your toothbrush, toothpaste, that sort of thing, any of your hair stuff. We do have the basics here if you do forget something, but we don't have your makeup, sorry. Okay. So what are some signs that I might be in labor? We lost our mucus plug, we have contractions, a backache, we're nesting, our water broke, bloody show, engagement, or the baby dropping into the pelvis, as I had said before. Okay. Mucus plug is a little, and I'll show you on one of the other films, it's a piece of mucus that is in the end of the cervix. If this was the cervix, it would be stuck in here, okay? And as the cervix opens, that plug falls out. That's why they called him, and it looks like a big blob of snot, okay? Just telling you, that's what it looks like. I don't need to see it, okay? I'm going to believe you if you tell me that you lost your mucus plug. Don't need to bring it to the hospital with you. We're good, okay? That's a sign that labor could be starting. It could still be 2 weeks. It does not mean that you're into labor and boom, you're going to have the baby in the next 24 hours, okay? Just letting you know that. Contractions are your uterus. It's a lot like your menstrual cramps, only much worse, okay? And they do come and go. And again, we'll talk more about the contractions as the time goes on. Backache is because of baby's position. Oftentimes you'll get a backache instead of contractions. And again, as the presentation goes on, I will show you those different things there. Have you heard of nesting? That's when moms decide that, oh, I need to get everything ready for this baby. So they go into their room and they put the diapers just so, and they put the clothes in the next drawer, and then, oh, I don't need that dresser here, I need that dresser over here. Or let's set the crib up here, no, let's set the crib up here. Or they decide that now's a good day to move the refrigerator and get the dust bunnies out of there, okay? All that is nesting. This is what moms do getting ready for baby, okay? It can get as bad as cleaning the windows and the ceilings and that sort of thing. So partners beware too that this could happen. If your water broke, we'll go into that in more detail too. Bloody show and the engagement, I'm going to go into more detail with those. Okay. When do I need to call my healthcare provider? At what point in time do they need to know? I'm sure they don't need to know every little contraction that we have, do they? No. Basically, these are the things that you want to call them right away if you notice any fluid from your vagina with or without contractions. Okay. Bleeding heavy enough that you need to wear a pad. You don't feel your baby moving as much. Contractions that are painful and are about 5 minutes apart. Okay? Those of you who live like an hour or so away, you might want to give them a call when it's more like 20 minutes apart. Okay? We want to be sure that you arrive and you arrive safely on the highway and with weather and the like. We want you to be safe. Okay. So contractions, what are they? What do they feel like? Okay. Feels like pressure in your abdominal or pelvic area, slightly more intense than your menstrual cramps. Can be a low backache, and most people describe it as like a hardening and a rising of your belly. So if you put your hand on your belly, you would feel it tightening like a ball and then relaxing, okay? When a contraction starts, that's your uterus getting hard, and then whenever it stops, it gets soft again. We time them from the beginning of one contraction to the beginning of the next contraction. Okay, so whenever we have the contractions, we're going to time them from the beginning of the contraction to the end of the contraction. This is just a nice little graph to kind of give us an idea of a contraction there. So if we were to count these, we'd start, okay, my belly's starting to get tight, okay, so I'm going to do that. And there's lots of apps on our phones to be able to help us with this. A stopwatch works real good too. So you're going to time it from the time that the contraction starts to the time the contraction ends. That tells me how long my contraction is lasting. Okay? Then we're also going to take note for how far apart our contractions are, which is from the start of one contraction to the start of the next contraction. Okay? That's where your timer on your phone comes in really handy too. Okay? Typically, whenever you're first starting out, they're anywhere between 5 and 30 minutes apart. Okay? Just to give you an idea as far as that goes. All right, so we're going to talk about some preterm labor. What is preterm labor? What are we going to do about it? Because we want to be sure baby comes on time, right? So contractions, preterm labor can be defined as contractions or labor before 37 weeks gestation. With pregnancy, like we talk a lot about in weeks instead of in months or that sort of thing, everything is by weeks. Okay? Symptoms of preterm labor include 4 or more contractions in an hour. The contractions are very strong. They're constant menstrual-like cramping, pressure in your back or tightening that comes and go in regular intervals, which are basically the contractions, mucus or bloody vaginal discharge, bleeding or spotting in the 2nd or 3rd trimester, which means after like the 20 weeks gestation. If you believe you're having preterm labor, get medical help right away. What determines whether that's preterm labor or not depends upon what your cervix is doing. Okay? The cervix is the lower part of your uterus, and it's not just contractions. Okay? And again, we'll talk about all that here in a little bit. Okay? So what do we do if we think that you're in preterm labor or that you are in labor? We're going to evaluate you. First thing you're going to do is call your provider. Hey, I think this is going on. Okay, what do you want me to do? The providers will sometimes have you do X, Y, and Z at home. Other times they'll say, get your butt in here to the hospital. Come now to get evaluated. Sometimes they'll say, let me see you in the office. Why don't you come on in? I'll see you at 2 o'clock or whatever, as far as that goes. Whenever you have that, they may do a pelvic exam to see if your cervix is dilated. Remember, that is how we know whether you're in labor or not, is whether your cervix has changed. We can only do that by checking it. Okay. We're going to monitor your uterine activity, see if you are contracting. We're going to monitor baby's heart rate. They may do an ultrasound, and they may recommend an amniocentesis, which is taking fluid from around the baby to check the baby's lung maturity. That's not done very often, but it is a tool that can be used to determine preterm labor. If you have contractions or preterm labor, but your cervix is still thick and closed, your doctor may ask you to just go home, drink lots of fluid, do fewer activities, get bed rest, lying on your side. Above all else, they're going to tell you no more intercourse and no nipple stimulation. Those cause contractions, so we really don't want to go there if we're not ready for baby to come. So how do I know? Is it the right thing? Is it the real thing? Is it not the real thing? Again, it's cervical change. Some of the things that are common though with false labor is your contractions are irregular. They're not getting close together. You'll have one, and then you'll have one 2 minutes later, and then it might be 30 minutes later, and then 3 minutes later, or 7 minutes later, and then 5. There's no set pattern to them, okay? They can be very irritating, but that's usually false labor, okay? True labor is those contractions are really regular, you can time them, and they're getting closer and closer and closer as labor progresses. False labor, the contractions may stop if you change your activity. Say you're at work and you're sitting at a desk and you're at your computer doing your stuff and you think you're having these contractions. Get up and walk around a little bit. Okay? Position changes will often, if it's false labor, they're going to make those contractions go away. If it's true labor, it doesn't matter what position you get in. It doesn't matter what you do. Those contractions are still coming and still on a regular basis. With false labor, the contractions are mostly in your belly. True labor, it can be in your belly, it can be on your back, it can start in your back, wrap around to the front. So with labor, we have divided it up into stages of labor. Our first stage has phases. Of course, it can't be uncomplicated here. It has 3 phases to the first stage, second and third and fourth stage of labor. These are some of the terms that I'm going to be talking about and using throughout this. And again, it's in the glossary in your book to also get the terms that we're using. Dilatation, effacement, NST or non-stress test. What we mean when we say complete, what's an intran, what's a fetal scalp electrode, EFM stands for external fetal monitoring, and PIT. And no, it's not a ditch somewhere. We'll get there. For baby to come, the cervix needs to be 10 centimeters, okay? About the size of a bagel, okay? It starts out like a Cheerio, okay? And then it progresses on through. This is just a neat little diagram so you have an idea of how big the cervix is whenever your provider says, oh, you're about 3 cms. It's about a slice of banana, okay? Or you're 7, that's a soda pop can. Okay. Another way of looking into it is this lovely funnel. This would be about 1 centimeter. This is more like 12. You only have to get to 10. But it gives you an idea of how small to how big we need it for baby to come through. Baby can't come through, right? Okay, so we got to get big enough for baby's head to come through. Okay, and no, it's not the Tin Man's head either, just saying. Okay. Other things that have to happen with your cervix, that it has to efface or get thinner. Okay. As you can see here, now this is a good picture. I told you I'd talk about that mucus plug. This is the picture of that mucus plug right there. Okay. This is a non-effaced cervix. See how it's kind of thick and long here? Okay. This is an effaced cervix, okay? See the difference there? It's now thinner. So it's kind of like as your funnel gets longer, it shortens up, okay? That's the effacement. Okay. This is what baby would look like inside altogether. That's a long, thick, closed baby. This one's probably about 2 centimeters, okay, just to give you an idea. Both things have to happen before baby can come. It doesn't matter what order. Some moms efface before they dilate. So you could be 2 centimeters and 90% effaced. Or you could be 8 centimeters and 50% effaced. Okay? Both have to happen before baby comes. There's no rhyme or reason as to which happens first. This is a tracing of our fetal monitoring. We had said before with some of the terms an external fetal monitor. This prints out looking like this. Looks like nice mountains. Okay, this is a nice strip. We like this. Okay, you'll be able to hear baby's heart rate. It prints us out on a graph. There you go. Down here is contractions. Okay, and that's part of our external fetal monitoring too. Is our contractions here. This isn't the world's greatest picture, but like I showed you in that earlier one, they tend to look like mountains, okay, as you get on. All right, and that's what we time, and this is how we use to time it when you're on the monitors here at the hospital. Okay? So, labor process stage 1. All right, this is the longest stage, and this early phase is the longest phase as well. During this phase, you're going to have regular contractions. Your cervix is going to change from a 0 to 4. Okay. You're going to have effacement and dilatation. What am I going to do? Okay, this early side, what are my feelings? What's going to be happening to my body at this point in time? So during this phase, you're going to feel excited, kind of relieved things are going on. You're going to be able to talk and walk, and you can probably ignore these contractions pretty much. Okay. Then we go into the active phase. The active phase, your contractions are becoming stronger. They're becoming closer together. Your cervix changes from 4 to 8 centimeters. Okay? This is the more painful. The contractions are getting your attention. They're saying, hello, pay attention to me, not over there, not that. And they totally get your attention. Okay? You're not going to be able to ignore these at all. Your bloody show increases. What is bloody show? It's what happens when your cervix dilates. The little blood vessels in there get broken, and you have a little bit of bloody discharge. We call it show because it's not active bleeding, like with your cycle and alike, and it's not what happens afterwards with the baby coming. It's just a little, when you wipe, you got some blood there, like, oh, okay. That's normal at this phase of labor. Okay? Relaxation becomes harder. You've got to work a little bit harder and find the thing that makes you relax a little bit better at this phase. So what is the role of the coach? Okay? Well, that changes, and it changes often. So coaches, beware. Okay? What's working now might not work in 5 minutes, but it might work again in 10. Okay? So just beware and be flexible with that. If she says don't touch me, that means don't touch me. Okay? If she tells you to get out of the room though, just back off a little bit, because in 2 seconds she's going to say, where are you? Why did you leave me? Why are you not here? Okay? So just be prepared for that change in, I don't want to say attitude, but demeanor that can happen during these phases of labor. The role of the coach, you can use relaxation techniques, you can assist with breathing, position changes, you can do some massage. We have birthing balls that we can use. We've got rocking chairs. We have all sorts of different things for position changes that we can use while you're here. We're going to encourage you to use your bathroom very frequently. We want that bladder to stay empty. The emptier the bladder, the more room baby has to come down and be able to come out. So we're going to ask you to be sure that you empty your bladder every couple of hours, whether you think you got to go or not, which usually isn't a problem with pregnant ladies. Okay. Chapstick, hard candy to eat, kind of keep your mouth hydrated. Those things are all good if your provider says that it's all right. Okay. So then we move from the active phase to transition phase. This is when it doesn't matter what you do, it's not right phase. Okay, you've heard about that, I'm sure. Contractions are closer yet. They're usually as close as 2 minutes apart, lasting about a minute each. So it feels like the contractions are right on top of each other. Your cervix changes from 8 to 10. It is the shortest phase. Okay? Some things that can happen, that will happen, not to everybody all the time, but between 7 and 10 centimeters, is they become shivering. They'll have hot, cold flashes. You get nauseous. You vomit. The legs cramp up. You get this urge that you got to push, that you've got to poop. And there's actually the feeling of baby coming. Okay? And your body tells you the baby's coming. It's hard to describe that until you're there. But when it's there, you know what I'm talking about when you get there. All right? Another common thing at this point in time is you want to go home and let somebody else do this labor and delivery. Okay? That's not uncommon. And you're like, I'm done. I'm done. Somebody else can do this, and I'll just come back later. Okay? There's no going back. Coaches, you need to stay. She's going to tell you to leave. Don't leave, like I said before. Just back down a little bit, back away. Just give her a chance. Her body's going through a whole lot of changes, and she doesn't know them herself. She's never experienced them before herself, so she doesn't know how to put that in perspective and get a hold of herself either. Okay? She has no control on these contractions and how she's feeling with that. Be as supportive as possible, coaches. And remove any rings that you might have on your fingers, because as they grab, they get a really nice grip, and I don't want you to lose your fingers. Offer drinks, offer some ice chips, things to keep them hydrated as well as they're going through this phase. So this is kind of a graph for those of you who like graphs and that sort of thing as to how labor is working, what the phases go through within your stage. This one here is stage 1. Down below here is the hours. Stage 1 can last up to 15, 12 hours. Okay, just kind of putzing along, doing its own thing. Okay, especially that early labor is a long period of time. Your active labor is shorter and your transition is the shortest. Okay? This graph also shows you stage 2 and stage 3. Okay. So we're done with phase 1. We're at 10 centimeters. We're ready to push. Doc or your midwife says, okay, let's go. It's time to push. Okay? That is called the second stage of labor. That's from the time that you're at 10 cms until the baby comes. Okay? Your cervix is going to be completely thinned out. You're going to be 10 centimeters. Okay? This is the part where we're going to be pushing. You can push in any position. The typical one is sitting almost in like a foot position with your body wrapped around your baby in a C position. That's the most common one, but you can do it on hands and knees. You can do it standing. It's not recommended, basically, because there's nothing underneath the baby. We have birthing bars, all sorts of things for that. It can take 2 to 3 hours for you to push your baby out, depending upon your pain management choices. Now, I know I haven't talked about that quite yet, but if you have an epidural or something like that, it can be up to 4 hours with pushing. Here are some of the positions for the pushing that you can use. There's the standing or squatting here. Again, these are generic pictures, so I didn't draw them. I'm not an artist. This is a side-lying one. If you notice when they're pushing, their knees are up towards your chest. Even sitting in this position here, which is the most common position, your knees are going to be up towards your nose. This is a knee-chest position, okay, or all fours, as they call it. And what happens is when you push the baby down in that direction. So coaches, what's your role? Okay, you're going to count with the pushes. Okay, the providers and the nurses will help you with that. While she's pushing, she's going to take a deep breath in, let it out. Take another deep breath in and hold it. And then she's going to push the baby out. It's helpful sometimes for counting to happen so she knows how long to hold her breath. If you count 1, 2, 3, she's going to kill you, okay? Just be forewarned. If you count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, that's not going to help her out either, okay? So we're going to get a cadence in there, and it's usually push 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a breath. At that point in time, mom's going to let her breath out. Take another breath in. Hold it and push again. We want about 3 to 4 pushes per contraction, okay? If mom can't hold her breath till 10, that's fine. Stops at 8. She's going to let her breath out. She's going to take another breath in and do it again. All right? We're going to help mom stay focused on her pushing. We're going to use sips of water as needed. And we're going to encourage mom that she can do this, that we're her cheerleaders and we're there to support her. Okay? That's all what we're doing here is helping her to win this race. Stage 3 is from the time of the delivery of the baby to the time of the delivery of the placenta. The placenta is the part of the pregnancy that is attached to the inside of your uterus, okay? And that's the part that has that long cord that goes into baby's umbilical. When they cut the cord, that's the part that has the cord, okay? That's attached to baby. That's what gives the baby its nutrients and all sorts of stuff during pregnancy, okay? Till that placenta comes, you're still considered pregnant. Okay? It's one of the shortest stages, and there's minimal discomfort. Just feels a lot of glop falling out and pushing out. Nothing compared to the baby. Okay? And then our stage 4 is recovery. Okay? Takes about an hour in the labor room to make sure that your bleeding is okay. We establish nursing, We're going to monitor your bleeding, your blood pressure, and your uterine placement within that hour to make sure that everything was within normal ranges. So now that we know what the phases are, let's go into some options for the pain management. Okay? You want to start with the least invasive. You want to start with maybe a shower. Maybe get into the jacuzzi. Massage, walking, relaxation exercises, music, breathing exercises, position changes. All these things don't cost anything, basically, and can help you out with your different phases of pain management. There's also medical management, which is IV medication, epidural, and a spinal. One of the least invasive is breathing. With the contractions, you want to breathe with the contractions. As that contraction starts and that mountain starts to go, the contraction is going to peak and then level off. As that contraction peaks, you're going to take a cleansing breath and breathe with it. Okay? The cleansing breath is just a better, like I said before with the pushing. Okay? Always begin and end your breathing with a cleansing breath. So let's say you're having a contraction. You're going to take your breath in, let it out, and then you're going to start your breathing. That's where you get your he's and your who's, if you've heard that calling. That just kind of helps you breathe through it. You can't hold your breath and push while you're breathing, okay? That's why in the early phases we want you to breathe through the contraction, and you'll hear us say that. Okay. Different patterns go with different points in your labor process. Okay. You can also use a focal point. You can use slow-paced breathing. You can use it with massage. Heart on belly pattern is what they've got limited here, and you literally are just touching your belly in a heart pattern. That sometimes helps out with your breathing. Focused pattern breathing is what I just described earlier, as you can see down here in this example, is you're going to take your cleansing breath in and out, and then little breaths in and out, 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 in and out during the contraction. When the contraction ends, then you're going to take that nice cleansing deep breath again to cleanse it out. Okay? This is helpful whenever you're 8 centimeters and you want to push, but you need to be 10. You're going to use that combination of short and long. Some of them call it panting, okay? Actually going like a puppy dog, okay? That helps. I know it sounds kind of weird, but it helps. Some of the things that you can do with IV medication for pain management include, it's called Nubane. It's often ordered every couple of hours, but it works best first time. Don't want to get it too early, but you don't want to wait until you're 8 centimeters to get it either, because that's going to go mostly to the baby, and you don't want it to go to the baby as far as that goes. IV medication will take the edge off of the pain. Okay, it's not going to take the pain all away, but it will take that edge off of it for you so that you can focus and get through the next contraction. Okay. Epidural is a common pain management option. Okay. And that is where they take and put anesthesia in the lower part of your spine, in the space next to your spinal column. It's not in the spinal column itself, but it's in the space that surrounds the nerves there. Okay. There's some pros and cons to it. One of them is you're going to have to sit up straight for them to put the epidural catheter in. They don't use the side lying too much because, as you can see, it kind of makes the back curve a little bit. Okay, so they're going to have you sit up, sit over. This is where bad posture is good. Okay, so you want to slouch over your baby, keep the back straight, hold it there, none of this twisting stuff as far as that goes. So, and we'll talk you through it whenever we're setting you up for that. Once you have your epidural, you're limited with your movement. You won't be able to get up and walk around. You're not going to be able to get up and go to the bathroom because it kind of numbs you from like your belly down to your toes. Okay? It can make them very numb. The idea of it is to stop the pain of the contractions so that you don't feel it. It will not help you with the pains of pushing. Okay? And that's good because you want to know what you're doing when you're pushing. but it will take care of the contraction pain for you. So baby's here, baby's coming. These are some of the medical interventions that they can use in labor to help the baby come. One of them is an episiotomy. An episiotomy is a cut in the vaginal area down towards the rectum or off to one side to make room for the baby's head to come out. It's not very often that it's used, but if baby's head's too big and baby needs to come, these are one of the ways that we can help baby to come. Your provider will cut that episiotomy if they believe that it is needed. And they will tell you as time comes that they think that that's needed. Other ways are forceps, which is over here in this photo, or a vacuum-assisted birth. Forceps are metal instruments that go along the side of the baby's head and help bring baby out as you're pushing. It does not pull the baby out. None of these devices will deliver the baby for you. You have to help. You have to push your baby out, okay? So these are just some tools that we can use to help get that along. I don't have a picture of the forceps here, but this is the what they would call the kiwi or the vacuum assisted. But this is placing the baby's head on there, suctioning it, and then pulling the baby as you're pushing. Okay? So the next thing we need to talk about are inductions and interventions that happen during the labor process. Okay? Induction, what's an induction? Well, an induction is causing labor to happen before it really wants to happen. Or there's a medical need that you need to have the baby, so we need to have labor come. Some of those reasons include, now these are again just initials and I'll go through them. PIH, pregnancy-induced hypertension. GDM, gestational diabetes. Low AFI means your amniotic fluid index is low. Post-dates means you're way past your due date, and that's usually about 2 weeks is post-dates. Anywhere between 40 and 42 weeks is post-dates. IUGR, intrauterine growth restriction, which means baby's not growing as well as we should be, so we need to have baby. And there's also the social reason. My husband's going out of town, he's been called, he's going to Iraq, so I need to have the baby now before he leaves on, to go for his job or for the military. Okay? What are some methods that we use? There's often medicines that we use to get labor started. One of them is prostaglandin gel. Cytotec is a little pill, often called the little pill of dynamite, because it can make things happen pretty good there. There's Pitocin. This is artificial rupture of membranes. Okay, so we can break your water for you. And we can do a mixture of one or all of these, depending upon the criteria and what needs to be done to get your baby to come. Okay. Some things that we use to help us in monitoring the baby. We have those electronic external monitors, but sometimes we need to do a little bit more accurate recording of the labor process. That would include using internal monitors. This is a scalp electrode, and what happens is the end of this is placed on the top of baby's head through the cervix. Your water has to be broken, and that gives us a very accurate baby heart rate. Okay? This is used whenever baby is just not tolerating labor at all. We can't find baby. Baby's swimming around all over the place because you had that Red Bull, and then you had some M&Ms, and then you decided you needed some coffee, and baby is just wild all over the place. Sometimes we need to do that because we need to see what baby is doing with the contractions. Another instrument that we use is an intrauterine pressure catheter, okay, which is a little monitor that slides in between baby's head and the uterus, okay, and it puts a little pressure on it there so we can measure when the contractions are happening and how long they were lasting and how strong they are. The ones on the outside don't tell us how strong they are, regardless of how big your mountains are. The ones on the inside give us an accurate rating as to how strong your contractions are, so we can adjust the medications as needed based on whether you're having accurate contractions or not. We can also use the episiotomy, which is making more room for the baby, forceps, and using a vacuum extractor. One of the other ways that they can do is using a, well, we call it a crochet hook, but this breaks the water, okay? And what it does is like a vaginal exam. They go in, snag the bag. That's another way that we put it sometimes. But just break the water that's around the baby, and that'll usually get labor started as well. So as baby's coming down the birth canal, the baby can come down in many positions, okay? If baby comes down this position, we call that sunny side up. Baby's looking up at mom's thing. Look where baby's head is. You know what that is? That's your tailbone. So as baby comes down, baby can put pressure on this. That can cause some of your back pain, okay? Often, and the most easiest way for baby to come down is for baby to be looking at your butt, okay? See where the back of baby's head is? It's up here more, not so much on your tailbone. As mommy pushes and baby comes out, baby kind of rotates a little bit through there and then comes out. He doesn't hold on to the pelvis here. They always hold on to the pelvis. Comes out and pushes it. That's how baby comes out of the pelvis, okay? Baby can come out sideways, but typically they don't. Typically it's either this way or this way, and they rotate their head around to come out, almost like cork screwing, okay? If baby is in position such as butt first, okay, it's not the safest way for baby to be born, and that will usually be a cesarean delivery. Sometimes babies put their little toes down there and they want to test the water, see if it's really cool or not cool out here. That's again going to be a cesarean delivery. If baby thinks that your pelvis is this nice little bed and he's curled up in here, okay, he can't come out that way. All right. Again, this would be a cesarean delivery. There have been, and believe it or not, I know you don't hear this, but sometimes the baby will take his hand down, okay? With that scares the providers, okay, just so you're saying, because when you go in there to check to see how dilated you are and the baby grabs your hand, that's not supposed to happen. So again, that doesn't mean necessarily a cesarean, because babies have, and I've been in a case where baby got scared because felt something he shouldn't, turned around and came back around the right way, okay? It happens. Nothing is in cement when it comes to childbirth and the like. But I just want to let you see the different positions that babies can be in prior to delivery, both a cesarean delivery and a vaginal delivery.